bad breath. Halitosis. Halitosis simply means bad breath, a problem that many people experience at one time or another. It is estimated that 40% of the population suffers from chronic halitosis at some time. There are many causes for bad breath, including poor oral hygiene, not brushing and flossing properly, gum disease, eating certain foods like onions or garlic, tobacco and alcohol products. In most cases, halitosis is caused by food remaining in the mouth, on the teeth, tongue, gums, and other structures collecting bacteria. Dead and dying bacterial cells release a sulfur that gives your breath an unpleasant odor. Dry mouth, caused by certain medications, medical disorders, and by decreased saliva flow during sleep. Systemic diseases such as cancer, diabetes, liver, and kidney disorders. How do I know if I have halitosis? One way to test if you have bad breath is to cover your mouth and nose with your hand. Exhale and smell your breath. Another way is to ask someone you trust whether or not your breath smells bad. Keep in mind that many people experience morning breaths, which is the result of reduced saliva flow during sleep that allows acids and other debris to decompose in the mouth. Brushing and flossing thoroughly before bed, and brushing your teeth and tongue first thing in the morning will usually eliminate morning breath. How can I help prevent halitosis? In addition to avoiding foods that cause bad breath, you can reduce the chances of bad breath by brushing thoroughly twice a day and flossing daily to remove plaque and food particles. Brushing your tongue will also help reduce bad breaths. Removing dentures each night and cleaning them well before replacing them each morning. Visiting your dentist regularly for dental checkups and cleanings. If you have persistent bad breath that is not improved with brushing and flossing, see your dentist for a thorough dental examination, as this could indicate a more serious problem. Only a dentist can tell you if you have gum disease, dry mouth, or excess plaque buildup as a possible cause of bad breath. Mouthwash. If your bad breath persists even after good oral hygiene, there are special products your dentist may prescribe. A mouthwash, which is an antibacterial liquid that kills germs and other bacteria present in your mouth that cause bad breath. Ask your dentist about trying some of these products.